Hello and welcome back to the hazardous medication video. This is the demonstration part of the video. You should have already viewed the basic components of the video. My name is Robin Herman. I'm the clinical nurse specialist for hematology and oncology, and my specialties in chemotherapy. And for the purpose of this demonstration, I'm going to show you how to handle your personal protective equipment when you're dealing with non-chemotherapy hazardous drugs. So once again, all RNs, LVNs, and nursing attendants and medical assistants that have been approved to administer medications will be able to give these non-chemotherapy hazardous drugs. First, I want to talk to you about gowning and gloving. Anytime you're handing any type of what we call the 2A category group, where there's any manipulation such as IV, IM, sub-Q, creams or gels, liquids, you should be double gloving and gowning. I'm going to talk to you about how you place the double gloves and gowns on. For our purposes today, the yellow gown meets the qualifications for the USP 800 and the NIOSH rules. I get a lot of questions about why we don't have the thicker blue gown that pharmacy uses. And once again, they have much more closer exposure, so they do need the extra thick gown. And these gowns do meet the NIOSH recommendations, so they are within compliance. So the first thing I want to do is show you how to put the gloves and gown on. I also want to mention that if you are dealing with any bodily excreta, stool, urine, emesis, all of that you should be double gloving and gowning whenever you're handling any bodily excreta for up to 48 hours after the hazardous drug is administered. If the patient is on an oral agent daily, then continuously handling any bodily excretion, stool, urine, emesis, once again, double glove and gown. So let's start with putting on our double gloves. Once again, the gloves should be changed every 30 minutes and or if torn, punctured, or contaminated. Your first pair of gloves, by the way, before you do anything with the patients and apply the gloves, you must wash your hands. Anytime you have any care interaction with the patient, wash your hands. It's mandatory. So I just want to mention that before we start. So once you wash your hands, you're going to put on your first pair of gloves. The nitro gloves that we have fit the NIOSH guidelines and the USP 800. They're purple in color and they're available on all of the units. The other glove that will also apply is the latex gloves, and where you're going to see the latex glove is in the sterile surgical gloves. But for this procedure, you do not need the sterile gloves, just the nitro gloves. The next thing you're going to do after you put on your first pair of gloves is put your gown on. So you're going to open the gown with the opening to the back. Put your hand in and put your thumb through the general hole. And that's your first pair of gloves. Now the reason for the double gloving is so that when you remove your top pair of gloves, you will not have any exposure to the, because you'll still have your bottom pair of gloves on. So NIOSH decided well over, I think it was in between 2006 and 2008 to double glove. And I will show you how you protect yourself when you take off your gloves. All right, so the second pair of gloves goes over your gown and over the cuff of your gown. So you have a complete seal, so you have no skin exposure to the hazardous drugs you're administering. And once again, this is the double gloving regimen. So first pair of gloves, gown, then your top pair of gloves. All right. The next issue or the next item that you're going to need to have on your unit when administering hazardous drugs, the intravenous type, is what you call your Spiros. And this is our new Spiros adapter. This was also mandated from USP 800 to have a new inline adapter, an additional adapter to protect us all from chemotherapy. So when your hazardous drug comes up from pharmacy, anything intravenous or in a syringe, it's going to have your little Spiros on here. And once the Spiros is applied, it does not come off. If you take this little cap off, the Spiros will not leak. If you have an open IV, Your Spiros will not leak until it's actually placed onto your IV tubing. All right. So your responsibility is to place a Spiros on the end of all IV hydration that has a hazardous medication attached to it. So when your hazardous drug comes up from pharmacy, it will be primed with saline and will have a Spiros on the tip. Now, if you are going to administer this drug in your IV line, you must have a Spiros on the end that will be attached to your IV hydration. Therefore, after you clean your adapter, you can then plug your chemotherapy in, and you will have 2 Spiros in line, and the whole purpose of the Spiros is to protect you from any chemotherapy. So that any time if your Spiros becomes disconnected from your extension set, there is no leakage at all. All right? Now, once the Spiros is on your tubing, it's on. It will not come off. So with every tubing change, you will be changing your Spiros. And every IV change, you will be changing your Spiros. So once again, I just want to show you, you will have 2 inline Spiros for all intravenous hazardous medications. And it will look like this, and it's leaking because I plugged it in. Once again, if you disconnect, no leakage. So that is the safety factor, why we are having 2 inline Spiros. So if the chemotherapy or the hazardous drug becomes disconnected here, or you get disconnected here from your extension tubing, you will not have any leakage. All righty. The other issue that's going to come up with a Spiros on it is any IM or sub-Q will also have a Spiros adapter on your syringe, and pharmacy will send it up in packaging. So you will have the Spiros. Once again, you will just plug your Spiros directly in to your IV tubing if you're pushing the drug or if you're injecting the drug. So once again, here's the Spiros. I just want to give you a little demonstration on how to put on the Spiros. It involves a little bit of pressure. You're going to take off your Spiros cap. You're going to put it on whatever lure lock, and you're going to twist it till it clicks. And you can hear the click. And then once it's on, it spins, it's on. And once again, nothing will leak, nothing will leak. If you lure lock this into anything, it will then flow. So the whole reason for the Spiros is a safety issue. All right. So that's your Spiros and your IV hydration. All righty. So let's say that you are now done with your hazardous drug administration, and you are ready to take off your personal protective equipment, your PPEs. Your top pair of gloves will come off. You will then take off your gown. And then your bottom pair of gloves, or which are considered the cleanest part of your PPEs, will then come off. And the whole bulk of all your PPEs will go into your yellow Sharps container. And we call it a Sharps only because it's similar to our red Sharps container. It's hard plastic. All righty? The other thing is anything that's attached to the patient that had hazardous drug flowing through it, when you're finished, all of this equipment will also go into the yellow Sharps container. All righty? So this is your safety, your Sharps safety container, but it's yellow, so it's chemotherapy and all hazardous medications that have been added to the NIOSH list. So this whole system, you would just disconnect from the patient and put it in. If you're going to leave your IV site in and just take off the chemotherapy, you just twist this. Once again, no leakage, and go in. All right? So that is how to place, put on, and off your personal protective equipment. Alrighty, so once again, you need double gloving and gowning when dealing with any intravenous or any drugs that you're going to manipulate, and also bodily excreta, urine, stool, and emesis. So double glove and gowning. And then you only need the Spiros, once again, on IV tubing that's going to get a hazardous drug. If you have a patient who's not getting any hazardous drugs, you can just use your regular tubing. If you are giving a drug that is on your hazardous drug list, you need a Spiros on the tip where it plugs into your extension set. All right. So next I want to talk a little bit about the spill kit. You should all have a spill kit on your safety area. So this is what your spill kit looks like. Your spill kit has everything you need in here to clean up the spills. And please review the spill section of this video. We're not going to spend time going through the instructions right now. I'm just spending the time to show you what's in the spill kit. So, as we said, with any size spill, nursing or whoever's been specially trained is probably going to clean it up. You do want to call the safety office with a large spill over 100 milliliters and discuss with them how they would like to proceed. But I have to tell you, in the chemotherapy areas, nursing cleans it up 100% of the time. So here's your spill kit. It's got a lot of goodies here in for you. It's got your double pair of gloves. So here's your gloves. And it's got your gown. So it's got your gown that you will place on. It also has a scooper, and I've